Hello my dear student, I am Dr. Parvez Ahmed. Today I am going to talk about the antihypertensive drugs. Before starting the pharmacology, first to understand fundamental things of hypertension. Okay, what is the mean by hypertension? Hypertension means in adults, if systolic blood pressure persistently increase above the 140 mmHg and diastolic blood pressure above the 19 mmHg, that means the person is suffer from hypertension. Now, types of the hypertensions. We know that two types of the hypertension. First one is the essential and second one is the secondary hypertension. In essential hypertension, a disorder of unknown origin affecting the blood pressure regulating mechanism, while in secondary it means this hypertension secondary to other disease. Now, we know that various environmental factor which aggravate the blood pressure or increase the blood pressure, that is the first one is the stress. We know that stress is the nowadays cause of all type of disease. Now, second part is very important. Second one is the sodium intake. Increase the sodium intake lead to the hypertension, raise the blood pressure. Now, third one is the obesity. Body weight is also one of the important factor to increase the blood pressure. That is why reduction of the body weight is important in case of hypertension. Now, next one is smoking. Smoking is also one of the factor for blood pressures. Okay. That is why in a non-pharmacological therapy, first you modify the all the factors, reduce the stress, reduce the sodium intake, reduce the obesity and stop the smoking and alcohol. So, these are the non-pharmacological therapy for the hypertension. Now, move to the pharmacology for antihypertensive drugs. So, here we have discussed the most important drugs we have used nowadays. First one is the beta blockers. We know that in a beta blockers nowadays two types, selective beta blockers and non-selective beta blockers. Selective beta blocker means, selective means that is these are drugs which block the beta 1 receptor. We know that beta 1 receptor where mostly present on a heart. Examples of the selective beta blockers are first one atenolol, second one metoprolol. Okay. Now, next one is a non-selective beta blocker. Non-selective beta blockers, most important is the propranolol. Okay. These are drugs widely used nowadays. Now, after the beta blockers, now next category is the ACE inhibitors, angiotensin converting enzyme inhibitors. Examples are captopril, enalapril, like drugs is an example of ACE inhibitors. These are drugs which prevent the conversion of angiotensin 1 to 2. Now, next one is a calcium channel blockers. We know that calcium channel blocker is a two types. First one is the dihydropyridine derivative, Example of dihydropyridine derivatives like nifedipine, amlodipine. Amlodipine nowadays widely used by the clinician. Now, second one is a non-dihydropyridine derivative. Examples are verapamil and diltiazem. Okay. These are the examples of calcium channel blockers. Now, move to the next categories. Next one is the alpha receptor antagonist, alpha 1 selective blockers. Examples are parazosine, terazosine, doxazosine and tamsulosin. Okay. So, these all are the example of selective alpha 1 blockers. Now, non-selective alpha blockers also you have used. Examples are phenoxybenzamin and phentolamine. Okay. Now, next one is alpha 2 receptor agonist, clonidine is a single example in this category. Clonidine we have used. Okay. Now, next one is a diuretics, is the most important drugs. Diuretics is a we know that is a various types. First one is a high efficacy diuretics like furosemide, torsemide, furosemide like drug, furosemide and torsemide like drugs. These are the example of high selling diuretics. Now, second one is the medium efficacy diuretics like chlorothiazide, hydrochlorothiazide, and third category is the thiazide like indapamide. Nowadays, indapamide is also widely used by the cardiologist. Okay, indapamide. Okay. Now, another categories of diuretics are potassium sparing diuretics. Potassium sparing diuretics means these are the drugs which save the potassium like spironolactone, trimethoprim. Okay. Now, move to the next category is a miscellaneous category. In miscellaneous category like arterial dilator like minoxidil, but nowadays minoxidil we have used in case of male baldness as a topical solutions like Mintop lotions we have used in case of male baldness. Digoxide also we have used, hydralazine also we have used. Now, arterial plus venous dilator like nitrates. Okay. Now, third one is the drugs with dilate artery plus vein like nitroprusides. These all are the example of vasodilators. Okay. So, these are the complete classification of drugs used in hypertension. Okay, thank you.